Hello, Board of Directors. My name is Kathy Macklin, and today's presentation basically outlines the facility's moral right to provide health care, keying in on three important elements: code of ethics, resource allocations, informed consent, and medical malpractice. The code of ethics was designed for professionals to follow as a standard of conduct. It gives specific guidelines as to how professionals should act and how they should serve others in an ethical manner. One of the responsibilities outlined in the Code of Ethics for healthcare professionals is to support the quality of life for those they care for. Resource allocations. Healthcare resource allocations is when administrators work through a long and difficult process to determine how limited resources should be used and applied when screening clients for services. Healthcare resources must be allocated in a manner that is fair and just when serving the people. It is important that decision makers remain ethical and moral when determining how limited resources should be used. When the demand and the need for resources outweighs the supply, healthcare administrators may not be able to meet everyone's needs. Informed consent. Informed consent is not just a piece of paper that you sign and say, okay, you are free to experiment on me, but rather constant communication between providers, patients, and their family members. It is a process in which an individual shows that they are knowledgeable and understands the communication between them and their providers regarding their healthcare status. There are 5 key elements that must be considered when establishing informed consent. First, the physician must be truthful and clear about the health and well being of the patient as well as their options for treatment. 2, the patients must be coherent well enough to make decisions regarding their care. 3, it is the responsibility of the provider to ensure that the information is conveyed clearly and that the patient understands. 4, the physician takes on the responsibility to create an environment for the patient that is free from them being swindled and to making abrupt decisions not carefully thought through. And 5, the last requirement to establish informed consent is when the patient signs the document in agreement that they are lucid enough to make decisions for themselves and that they understand fully about their healthcare situation, and it also an agreement that the physician can furthermore do their duty. Medical malpractice. When medical treatment for individuals does not meet basic standard of care and fault has been proven, healthcare providers risk the chance of committing negligence. Before individuals can even file a claim that a provider has been negligent, they must first prove that their injuries were caused because of their negligence. Some examples of these are neck injuries, wrongful deaths, in some instances, property owner negligence, brain injuries, failure to diagnose or misdiagnose, surgery that has been done but was unnecessary, and last but not least, administering the wrong medication or dosage. Thank you for tuning in to the presentation.